I've lost my team. Good afternoon. Good afternoon, Rhode Island. It's a beautiful sunny day. I hope you have the opportunity to get outside a little bit today, enjoy the warmth, enjoy the sunshine. I want to thank you for continuing to tune in to these daily press events. Tomorrow we will be back at 1 o'clock, and then we're going to stick with the 1 o'clock from there on. I do encourage you all to continue to tune in or listen later. We will be sharing additional information every day around businesses reopening, new regulations, and it still continues to be the best place that you can get information about the coronavirus here in the state of Rhode Island. If you would like to have email sent to you every day to get a daily coronavirus email, you can go online to www.governor.ri.gov. There's a button at the top of the website, and you can sign up for a daily coronavirus newsletter, and we'd be happy to send you our latest issue every morning. So we'll begin, as we always do, with the data. You'll see from the data on your screen, still seeing a plateau, which is good news. That should give you confidence. The steps we've taken are working. We are still seeing a plateau. We have 221 new cases. So we haven't seen a decline. I do hope for the day when we start to see a persistent decline, though hospitalizations are declining, cases are flat and have been for weeks, and very sadly, we have another 18 deaths. And it's just ever again a reminder that this virus is taking a huge toll on the people of Rhode Island, and families who've lost a loved one is significant, and our thoughts and prayers are with you. As we begin the process of phase one and getting back out there again, maybe going shopping, maybe going to the park and getting out a little more, I just want to remind everybody that it's more important than ever to follow the rules. Wear your mask, wash your hands, keep a safe distance from folks, don't go out if you're sick. Really simple, but life-saving and very important. Keep your contact tracing notebook. Takes a minute at the end of every day, where you've been and who you've been with. That's going to be vital. At the same time you're following the rules, I do want to encourage you to go ahead and get back out there. I hear from people, you're afraid. I've been getting a lot of emails from people saying, Governor, I know you say it's okay to go out, but I'm just not comfortable. And I understand that. You have to go at your own pace. And the name of the game in phase one is slow and cautious. It's a toe in the water, slow and steady. Having said that, I would encourage you to, if you have an errand to do and there's a shop that's open, I especially want to make a note about those of you who have been putting off doctor's appointments, a procedure at the hospital, or any kind of health care. The hospitals are open. They are open, and if you need to go, some of you have been putting off cancer treatment, some of you have been putting off procedures, some of you have been putting off surgeries. I'm sorry that you had to put them off, but I want you to know hospitals are open all around the state. They are open and they are safe. Please do not delay. Please do not let your fear of the coronavirus prevent you from getting the medical care that you need. The last thing we can afford is for folks to get sicker because they're afraid to go into the hospital. All the lifespan hospitals, the Care New England hospitals, they are reopening as of this week for non-critical surgeries and non-critical procedures. If they reach out to you to reschedule, your doctor reaches out to you to reschedule, I'm going to urge you, please, to go ahead and reschedule. Have the courage and faith and confidence that it is safe for you to go to the hospital and get the care that you need. And I've been in touch every day with hospitals, and they are urging me to deliver that message. So I want you to feel comfortable. I have a few announcements today around work that we are doing to help meet the very practical needs of Rhode Islanders and Rhode Island small businesses as we begin to reopen business, and frankly, as we get through another day or another week of this virus. Throughout this crisis, I have tried every day to listen to people and meet people where they are and just try to respond to practical everyday demands, whether that's, fixing the way we deliver unemployment insurance so you don't have to get a busy signal, or, whether it's setting up a hotline at the Commerce Department so you have a single place to call. And so to that end, we've been hearing from businesses who are saying, okay, Governor, I'm a small retail shop. I'm thrilled to be able to open again, but I need a hand to figure out how to reopen. Where do I get cleaning supplies? I don't quite have access to masks yet. Or people saying, you're telling us to work from home, you're telling us to go to school from home, but I don't have a computer, or I don't have laptops for my employees so that they can work from home. So to that end, the following announcements I have are designed to help you out in simple but important ways to make your lives a tiny bit easier as we begin this next phase. So I'm announcing now that starting next week, we'll be distributing 500,000 masks as well as disinfectant solution through a collaboration with our state's industry associations and chambers of commerce. The supplies are going to be available to small businesses. We're focusing on the smallest businesses with 50 or fewer employees, including retailers, restaurants, manufacturers, the smallest of our businesses, frankly, the ones that have been hit the hardest and the ones that are struggling the most in getting their hands on the supplies they need to reopen safely with the new guidelines. These businesses are going to be able to pick up about a month's supply of face coverings, surgical masks, as well as a voucher for disinfectant that can be purchased from any Ocean State job lot store in the state of Rhode Island. And we are hoping to have this ready to go next week. The goal would be to roll this out next week. So to obtain the supplies, if you're a business of 50 or fewer, you need to show that you've completed your COVID-19 control plan. We need to see your checklist that you're ready to go. There's a template for that plan on reopeningri.com. So let me rephrase. If you're a small business, let's say you're a small retailer, you want to get back into the business of reopening, it's confusing. Step one, go to reopeningri.com and look at the reopening template. We want to hold your hand and walk you through it to show you what's expected of you. Then, if this could help you out, if you need a hand to get an initial shipment of surgical masks or masks and disinfectant, you can go ahead and sign up for that. This is meant to be about a month. It's kind of a starter installation, just to give you a hand as you begin to learn how to operate in this new normal. For more information about everything I've just said, you can go to Commerce RI. You can learn about this initiative. Also there, we'll be distributing this through local organizations and chambers of commerce and business associations. So you can have a look at the list of those business associations and figure out the easiest way for you to go ahead and pick up your supplies. And then, as I say, you can also get a voucher, which you can redeem at Job Lot for your cleaning supplies. I need to give, this is no small feat, right? Securing 500,000 masks, figuring out a simple way to distribute them to our smallest businesses. Might sound easy, it's a logistical challenge. It would not have happened without the terrific work and leadership of Steve King. Steve King runs Quonset Development Corporation, although for the past 2.5 months, he's been full-time managing the state's supply chain of PPE, and I want to thank him publicly for his unbelievable service. Additionally, in the same vein, I'm also pleased to announce that thanks to a generous donation from Microsoft, we also have 500 laptops available for Rhode Island small businesses. We'll be making those laptops available to businesses with 25 or fewer employees. So we've been hearing from small businesses, they want to sell more online, they want to enable folks to work from home, they need a hand with the equipment, the software, and the technical know-how. So we hope that the availability of these 500 laptops will give you a hand. I do want to remind everyone that we still have our Commerce hotline. 521-HELP, and we're still providing free technical assistance and coaching to small businesses who need that kind of consultation. For the free laptops, applications will be available on the Commerce website, commerceri.com, in both English and Spanish, and those applications are due on May 26th. That's for the free laptops. To do this and to make sure we're reaching into the community, reaching into women and minority-owned businesses, reaching into the smallest businesses out there, Commerce is partnering with a number of community organizations, including Social Enterprise Greenhouse, the Hispanic Chamber of Commerce, the Rhode Island Black Business Association, Center for Women in Enterprise, and the Rhode Island Hospitality Association, among others. So I hope that those laptops help you out. I will say, I want to give us a moment to give a special thank you to all of the business associations who are working with us. We couldn't be doing what we are doing without the Hospitality Association, the 13 Chambers of Commerce, Black Business Association. We are on the phone with these groups, the Rhode Island Manufacturers Association, daily, getting feedback from the ground truth of what's going on in these businesses and helping us to reach out to these businesses. So a very big thank you to all of you, and I look forward to continued collaboration and partnership as we go through the weeks and months ahead. Microsoft has also donated another 500 new laptops to support our state's education needs. So right now we have kids in distance learning, we have college students in distance learning. Some of these kids don't have laptops, so we are going to be making another 500 laptops available to Rhode Island College. We've heard there's a need there to help some of those students, and to schools and districts that have an identified need where some kids need a hand with a laptop. So I want to give a big thank you to Microsoft for a generous donation of 1,000 laptops, and I hope it's some relief to those of you out there who could use a computer. Okay, I want to take a minute to talk about testing. Testing it's a big deal. You know, it's the way we're going to get through the next 9 or 12 months of this crisis. Testing won't prevent somebody from getting sick per se, but what it will allow us to do is keep a lid on the virus by letting us know who is sick, who they were exposed to, and therefore how we can prevent any major outbreaks. We are going to be living with this virus for until there's a vaccine. Best guess is sometime early next year, March, April, there'll be a vaccine widely available. Hopefully before then, there'll be a highly effective therapy. No matter how you cut it, we're living with this for months. That I can't stop. So what we can do is make sure we have the systems in place that will enable us to get back to work and back to school without overrunning our healthcare system. The bedrock of that is testing and contact tracing. Test folks, figure out who they were in contact with, and then isolate and quarantine. So last week I talked about our overall testing strategy. Our strategy is to make sure everyone with symptoms, if you have a cough, if you have a fever, can get a test within a day. That's the goal. Right now, we're doing about 3,000 of those sorts of tests a day on people with symptoms. We also want to be able to react quickly to an outbreak. Our goal is to be on the scene of an outbreak within 4 hours. So we need to be focused on mobile testing. Let's say there's an outbreak in a manufacturing operation, an outbreak in a nursing home, an outbreak in the veterans home. We want to get there and do rapid testing. And also, at the same time, we are creating an early warning system by testing groups of asymptomatic individuals. So as we go through this in the months to come, we'll be just doing random samples of testing of folks who might not feel sick. We want to get a handle on, I think of this as an early warning system. What's going on in this community? What's going on in this school? What's going on this college campus? What's going on this big corporate campus? That'll give us an early warning signal so that we're never again behind. If we've learned one thing, it's that we can't get behind this virus. We always have to stay a step ahead. Once we're behind, it overruns us. So in the past week, we have really scaled our symptomatic testing in our hardest hit communities. We've launched a new site at the Rhode Island Free Clinic in Providence. We've tripled our testing capacity in Woonsocket. I'll say, if we're in Central Falls or we're in Woonsocket, the positive test rates in some of these communities, in poorer communities, in dense urban areas, in immigrant communities is high. It is higher. And so what that means is we have to do more testing. The CDC says you have to do enough testing until your test positive rate is below 10%. Now we're there as a state, but we are not there in these communities. So we have to really keep our eye on it. And it's why I keep saying we're not out of the woods yet. And so that's what we are going to continue to do. I want to say this, as we're getting more into these communities that have been hardest hit, dense urban communities, poor communities, communities where folks don't have cars, communities where they're undocumented immigrants, we hear people are afraid. They don't want to get tested. They're afraid to get tested. They feel they don't have the money to get tested. So let me say this. Testing is free. If you can't afford it, if you don't have insurance, we'll pay for it. It's easy to do. It won't take more than a couple minutes. No one's going to ask you about your immigration status. We have places in your community that you can walk over to. Please, please, please get tested. If you're hearing me now, if you are sick and you've been afraid to go and get your test, it'll help you, it'll help your family, it'll help you and your family get back to work, it'll help your whole community. And I know from talking to the mayors in Central Falls and Woonsocket and Providence, they're concerned. They're concerned about the high positive rate in those communities. And I share that concern, and I want you to know we're on it, we're leaning into it, we're going to continue to test, we're going to get into the community until we drive those positive percentages down from 15, 20% to below 10%. If you have any questions about what I've just said, we have a phone number you can call. We've set up something called The Point, which is a place that you can get confidential information 24/7. The number is 462-4444. By the way, you can also get information there about housing, food delivery, quarantining, anything you feel you need to get the support you need. I also want to provide a quick update on what I announced last week around the this early warning system. So last week we announced we were starting our first round of serology testing. That's the blood test. We sent out letters inviting a random sample of thousands of Rhode Islanders to participate in the diagnostic test and the blood test. We've decided to run that through a number of stop and shops across the state. Early days, we just started, but so far so good. Again, we want to get into the community. So today I'm announcing that in addition to the 4 original locations in North Providence, Pawtucket, Cranston, and Newport, we are also adding new sites for testing. Both of the new sites are in Providence. They are both 2 more stop and shops, one on Manton Avenue and one on West River Street. So again, we want to meet folks where they are in their community. As a reminder, you will get a letter in the mail. It will invite you to be tested. It is your choice to say yes or no. I would encourage you to do it, and you will be given a window of time in which you can show up at a particular Stop and Shop. You can go there and you can be tested. But don't just show up at Stop and Shop. So if you need to receive a letter, it'll tell you where to go to Stop and Shop and when to go to Stop and Shop. Please do that. But if you haven't received a letter, please don't just show up. If you're afraid, I'd encourage you to do it. And having said that, we're not going to force anybody. It is your choice. I hope you do it. If you can't do it for whatever reason, that's okay too. So with that, I'm going to turn it over to Dr. Nicole Alexander Scott, and then I'll come back to answer your questions. Sorry.
Good afternoon, everyone. Thank you to the reporters joining us in person, and thank you to everyone who's tuning in. As usual, I'll start with a quick snapshot of the data for the day. As a reminder, we have an enormous amount of data posted online on the COVID-19 data page on the Rhode Island Department of Health website. We have 221 new cases to report. There are currently 269 patients hospitalized, and of those 269, 68 are in the intensive care unit and 48 are currently on a ventilator. As the governor has been saying, the stability and slight drops we have seen in these numbers are a good sign and a reflection of the community mitigation work that Rhode Islanders have done. Unfortunately, we have 18 additional COVID-19 associated fatalities to report. One of these people was in their 50s, one of these people was in their 60s, everyone else was in their 70s, 80s, and 90s. 6 who passed away were in their 70s, 6 who passed away were in their 80s, and sadly 4 who passed away were in their 90s. Our thoughts and prayers are with these families, and our thoughts and prayers are with all Rhode Islanders who are dealing with loss or who are trying to manage any kind of heightened anxiety at this time, all of which are understandable and challenging. That could be anxiety related to uncertainty about finances and employment, or it can be worried about the safety of loved ones. If you're able to, please take a moment today, and maybe even every day, to remember those who are dealing with extreme difficulty right now. We need to be able to support each other, even in our thoughts. So shifting gears, I want to recognize and thank Thundermist and Woonsocket for their work to get a testing site set up in the city. As I've said before, getting COVID-19 resources and support services into communities throughout the state, including our core cities, is absolutely critical. Thundermist is the organization in Woonsocket that convenes the health equity zones in that community. Our health equity zones, which the governor referenced yesterday, are areas throughout Rhode Island where residents and organizations are coming together to identify the health issues in their community that they believe need addressing, impacting their living conditions. They then work together in a targeted way, focusing on outcomes to address those issues to build health at the community level. That's economic health, it's physical health, and all of the elements that are connected to that. I often say that health does not start in the doctor's office. Health starts in the communities where we live and the schools we attend. Our health is determined by things like job opportunities we have access to, transportation we have access to, healthy foods like fresh fruits and vegetables that are readily available. We get asked regularly about why we see higher rates of COVID-19 in certain communities in Rhode Island. And as we have been saying, one immediate reason is because these are communities where many people live who are members of our frontline critical infrastructure workforce. We need to take immediate steps to support these people in the short term. Thus, the governor's announcement today to small businesses about being able to make sure that they have the personal protective equipment that's needed to support critical infrastructure workforce, like those who are out in a restaurant or going to certain manufacturing plants. One great example as well is the Workforce Stabilization Fund that the governor spoke about yesterday, which is getting bonuses to lower wage frontline workers. We also have a whole equity considerations team that's exploring other measures we can and need to take. We've also been trying to get at the underlying structural issues that make people more vulnerable to health issues to begin with. This is work that started long before COVID-19, and it's work that involves direct community engagement to sustain the improvements that we need going forward. We want to use the existing infrastructure that we have at the community level, like health equity zones and other community-based organizations, embedded with the people who are seeking to have their voice be lifted so that they can help people, family, and neighborhoods be able to bounce forward after this response. After a crisis like this, our aim isn't just to bounce back. We want to bounce forward so that everyone has an equal opportunity to be healthy and that we are in a better place on the other side of this. Lastly, before opening things up for questions, I want to remind businesses that they should be working on their COVID-19 control plans, and we want to help support all businesses to be able to do that. We want all businesses to be pulling together these plans on how they will be keeping employees and customers safe by doing what they can to prevent the spread of COVID-19. One clarification that I want to make is that all businesses need to have their COVID-19 control plans by next Monday, May 18th. And that includes businesses that have closed and are looking to reopen. And it also includes businesses that never closed and that remained open. We have a template on reopeningri.com. If you are a business owner who has not yet visited reopeningri.com, please do so today. As I said yesterday, Secretary Pryor and his team have been doing phenomenal work in providing for you whatever they can to answer your questions and to be in partnership with people throughout the state's COVID-19 response. If you have questions, you can either write to covidplan@reopeningri.com or call 401-521-HELP. We are here to help you so that all Rhode Islanders will know that it is safe and feel comfortable to start re-engaging in Rhode Island businesses. Let's get started with questions. Thank you.
Governor, the Washington Post reports today that you're going to require summer visitors to quarantine for 14 days if they come to Rhode Island to visit. Is that correct?
That is not correct. What I said and what is correct is we're thinking about it. I want to figure out how we can enable some tourism. You know, Newport, Westerly, all of Quinnipiac Island, a big percent of our economy is tourism. And so what the Commerce Secretary and I are doing with our community mitigation team is figuring out how do we do that? And one option could be testing tourists. Then the question becomes, can we do that? Do we have the capacity? How do we administer that? So we're looking at it. We're trying to figure it out.
What will be some of your determining factors?
That what I just said, you know, how many tests would that require? How would we administer that? Could we work with the Hospitality Association to do that? Obviously, it couldn't be forced. It would be encouraged. So basically what we're trying to do, we're spending a lot of time asking ourselves, how do we safely get people back to work and also help people to feel confident? So frankly, we're having the same discussion about hairdressers. Like, we want hairdressers to be able to get back to work. We also want their customers and clients to feel safe that it's okay to be in close distance to the hairdresser. So would it help if we could test some or all hairdressers? So this is just to give you a view into how we're thinking about it. We want people to feel, yesterday you asked a question, Governor, you can open restaurants, but if people are afraid to go, it's not going to help our economy. So we're just trying to get creative and figure out, can we use testing to give people confidence?
Just to follow up on that, is there a scenario where you potentially would continue the 14-day quarantine throughout the summer for out-of-staters?
I don't think so. I'm hesitating because I don't know. I don't know what July is going to look like. I cannot stand here today in the second week of May and say, this is what I think is going to happen in July. However, I can tell you my hope and plan and intention is to be, into phase 3 and relaxing that sort of a travel quarantine. So that's the hope. That's what we're working for. We work for the best and plan for the worst. This is an area that I'm in good contact with the other governors in this region on. So we are trying to come up with a shared travel policy, and we're not quite there yet, but that's the plan.
Governor, next week the courts will reopen and eviction proceedings will begin for hundreds of Rhode Islanders. Why don't we have a statewide eviction moratorium like our neighbors?
Just say it one more time, please.
Why don't we have a statewide eviction moratorium like our neighbors?
Yeah.
Considering courts are reopening and people will start to be evicted.
Getting worried. So I'm working hard on that, figuring out what we can do. I'm worried about it. The courts may or may not reopen. They are still trying to figure that out. I'm working on figuring out more rental assistance, as well as a potential moratorium. We're in close contact with the district court on this. So it's within the next few days, certainly by Monday, I'll have more to say about it.
On rental assistance, we've allocated $1.5 million, and our other states with similar populations have allocated about 30 times that much.
Yeah, no, it's not enough. That was a beginning that we moved quickly, and great credit goes to the Commerce Secretary. He figured out a way to get that done quickly with existing HUD funds, but I agree, we need to do more.
Thank you.
Dr. Alexander Scott, there's a new study out today, a second study that has shown that these Abbott rapid tests are missing about 1/3 to 1/2 of positive results as compared with the slower, more traditional COVID-19 tests. How can Rhode Islanders be assured that these rapid testing sites like in Lincoln and Central Falls are catching all of the positive cases?
It's exactly what our Rhode Island COVID-19 testing and validation task force is looking into, so that we can really have an understanding of how it has impacted Rhode Island and how we should be using it to message to the public. We have spoken about the fact that the tests work better when people have symptoms. These studies help reinforce that, particularly if you have people without symptoms who are getting tested. And it's important also, just going forward, regardless of the type of test, if someone has symptoms and has a negative result, we are saying still stay home if you're ill. Continue to do the same type of isolation that would be required, whether it's the flu or COVID-19 or a cold. So we want to keep working with the public to gain that information. And as we have said, particularly if someone doesn't have symptoms where the test isn't reliable, it is mostly in those situations helpful if it's positive. And then making sure people have the information they need on how to still do what needs to be done if there is a negative result.
Can you pledge to release site-by-site testing data so that we can compare positive rates at the traditional sites and positive rates from the rapid testing sites?
We can work towards something along those lines because we do have the data, and give us some time to work on that.
Governor, you had mentioned a very substantial need for CNAs in Rhode Island, a huge shortage. We don't know that. But we've been in contact with, I interviewed earlier today, the clinical director of a CNA training program. And she said that they were effectively shut down on their training program on March 30th, and they've been trying to get authorizations to restart their CNA training programs using virtual teaching methods, simulations, and clinical practice, whatever is necessary. And she said her standard course is 80 hours classroom, 40 hours clinical practice. And she has 50 students, she said, ready to go in a night program and a day program, but they can't get authorization from the Department of Health, and they've been in communication with everybody from the Department of Health, the nurse licensing board, and so on, but they just can't get anything moving, and they've been trying for, I guess, 6 weeks now. What should she do, and what is your response to that? What are your recommendations?
I'd ask to get her name from you, if you can give that to Jen, so that we can work on it, because the focus has been to accelerate it. So hearing that type of feedback that shows that we still need to improve on that particular situation, which is hopefully just an exception, is something that we will address immediately.
Are there any impediments to doing virtual training of CNA candidates?
No, that has been what we've wanted to happen. Instead of bringing groups of people in to do the training, how can we support it being done virtually so that we can accelerate it
One of the things
currently?
she said she proposed to the Department of Health was having groups of less than or fewer than 5 people. Is that another option that's worth considering?
It's something that we can certainly consider.
Thank you.
Brian Lejeune.
Governor, you have mentioned again that Rhode Island is around 3,000 tests a day, but most days, especially lately, it has not been that much.
Yeah.
Is there just not the demand? I know there's the weekend issues and stuff like that. Is there just not the demand for these tests? And what are you seeing? And where can you pinpoint where some of the positive test clusters are coming from? Is it still a lot of healthcare workers?
Yes, really excellent question. So, and something we've been working hard on. We did see maybe the last week or so, we did see a kind of a dip, or at least not an acceleration that we wanted in referrals coming from physicians. You know, because what we told people is if you feel sick, call your doctor will get you a test. And we weren't seeing the kind of throughput and volume that we wanted to see from our PCPs. So we have worked very hard on that. Ken Brindamore, who runs testing, along with Dr. Alexander Scott and the physician groups, to try to make it easier for them to do the ordering and just push the message that we want to increase our testing. So I am hopeful that that will help. I think we've made, just this morning, we had an update call on that, and I think we're going to see progress. In terms of places that we're testing, to be very candid, where we're most focused now in terms of testing is getting into the community. So you have a place like Central Falls. It's the percent positive is high. You know, we want to be below 10%. It is much higher than that. So we are going to have to do more testing in Central Falls. We just bulked up in Woonsocket. Now these testing these places are very low volume. So on a good day, on a walkthrough, you might have 50, 60 people walking through. But our focus is to ramp up to have more of those low volume, and that just takes time to get the volume. I think you'll see another big wave this summer when we start opening more, and then you're going to see a much bigger wave when school comes back. So we're trying to build a system that's capable of 10,000 in the summer and 15 to 20,000 when the kids come back in the fall.
Governor, if you could provide guidance to some realtors, again, it's kind of a follow-up, but they're getting phone calls from people from out of state that want to rent a beach house in Rhode Island. And one man, Michael, questioned, should he treat all states the same? Should someone from Rhode Island be treated different than Massachusetts? And then what about New Jersey, or if he gets a call from someone from California?
Yeah, so I'm going to answer it, and then I'm going to give Stefan a second. The honest answer is we don't yet have a summer policy. Okay, the honest answer is we're 5 days into phase 1, and that's a phase 2 or 3 activity, and I don't yet have a policy. We're working hard to get a policy. The challenge is it's hard to know in May where you're going to be in June or July. So I just need a little more time to give you better and clearer.
Comfortable renting a
Yeah.
beach house?
Oh
for
yeah,
summer?
of course.
Okay.
Yeah, absolutely.
The additional note I would make is that there's a 7-state consortium now that was formed to dialogue around policies that ought to be regional. And I can tell you there is active dialogue on a weekly basis among all of the states across a broad array of issues. Dr. Alexander Scott and I participate in that, and there are subgroups that are dialoguing around particular issues. So travel policies and various principles and recommendations pertaining to tourism are a subject of conversation. And just while I'm up here, just a quick note on one of the primary subjects the governor touched upon. Just note on the free supplies, that is the masks and the disinfectant cleaner. Please look to the website starting early next week, starting on Monday, for information on the availability of that.
Could you just touch on campgrounds as well and what those 7 states are? Apparently some people, they have self-contained campers that they don't have to use the public restroom, and they're telling me that the campgrounds are still closed. So could you touch on that?
Sure. I can tell you that that is also a subject that we are discussing among the 7 states, and following this press conference, I'll see whether we can provide additional guidance. But that is likewise a collective conversation, very active as to campgrounds and as to summer camp.
What are those 7 states, if you don't mind either one?
Sure. The 7 states, let's see if I can get that from memory. That is Massachusetts, it is Connecticut, Rhode Island, New York, New Jersey, Delaware, Pennsylvania. Is that 7? Accomplished. Thank you.
I do want to say one thing, because I really feel for people who are trying to figure out how to do their business. If there's a lot of Rhode Islanders, maybe you live in Providence and you get the same summer house in Narragansett every year, I think I would feel comfortable booking that. So, I can't tell anyone what to do, but I think it's fair to say if you're used to getting such and such a house, 3rd week of July, go for it. I really want to find a way also for folks from other states to do the same thing. And I have every reason to believe we're going to get there. I just don't, as Stefan just explained, we're trying to have the same policy in the whole region, and we're just not quite there yet. As it relates to campgrounds, Janet Coit, who runs DEM, is working very hard on a plan for campgrounds and beaches, and we're hoping to have an announcement about that probably not until the week after next. Campgrounds and beaches.
Bill and Mark.
Secretary Pryor, I watched your address last night, guidance for restaurants. And I noted that you'd mentioned the earliest that phase 2 might happen is June 1st. So my question again is pardon?
For restaurants, correct.
For restaurants to go indoors. What's your message to restaurateurs right now about the infrastructure outside of hand sanitizer and masks? For example, they may have to rent a porta-john, or there may be cities that are blocking streets and so on and so forth. Is that really going to be just for 2 weeks of outdoor dining? Do you suspect we'll be back to some sort of indoor dining in a short amount of time where restaurateurs shouldn't necessarily make that investment right now?
A few points. First, it's very important that under the governor's testing the water approach, we attempt to incrementally implement our plans. So it's important that we are successful with outdoor dining, at least in a handful of locations, more, so that we know how we can be effective indoors. So we're very pleased that there are restaurant owners who are gearing up to open up in an outdoor setting. We had a call with the Hospitality Association board today, and I know that there are restaurateurs who are actively gearing up. There are those that are going to take a pass and wait. But why do these couple weeks? And let's keep in mind, it could be longer. I'll come back to that point. Why do they matter? Because we know we can get the systems right for the larger scale implementation of indoors. So we do need to work through a number of issues. The Department of Business Regulation under Director Liz Tanner has been charged by the governor with helping restaurant owners work through municipal issues. So if a restaurant owner wishes to put up a tent, so long as there's adequate ventilation, we don't want to simulate an indoor environment. If they want to put up a tent to protect from the elements, and they need to work through the process with the municipality, we can do that. If there's a closed street and they want to utilize that space to set up for restaurant purposes, we can help you work with the city or town. And I want to also thank Brian Daniels and Mayor Diosa, the executive director and the chair of the League of Cities and Towns. They've been working very closely with us on these policies and approaches. We know that there's a lot of problem solving that needs to occur, but it's very important that we get it right in this first portion of the exercise. The governor has said multiple times, and I said I would come back to this point. The governor has said multiple times, the length of our phases will depend upon the public health data as guided by Dr. Alexander Scott. So it could be longer that we remain in this phase before we transition to indoor seating. We do hope that more restaurant owners give it a try.
Just follow up as well, a specific point, may patrons use bathrooms inside restaurants?
Yes.
They may?
Yes, that's definitive and it's in our guidance. The bathroom utilization indoors is allowed. We request and expect more frequent cleanings of the bathrooms than may have routinely occurred in the old normal. We also ask that patrons, the customers of a restaurant, when they're walking to the bathroom or through the establishment in any way, wear a mask. So these things are laid out, and we did a Facebook Live yesterday, and we did a conference call with the Hospitality Association today to get the word out.
Mark?
Governor, I was wondering if you can tell us about any contact you had with your own mother on Mother's Day and how you handled that so that you'd comply with all of the guidelines that you've given about meeting with the elderly in different circumstances like that.
So we called her. The kids and I, my husband, we called her. I have been able to see her. Thankfully, I've been well and she's been well. But, you know, it was a different kind of Mother's Day. We had like a family phone call. And, but I think she appreciated it. She doesn't want to get sick. And she's kind of rolling with it. So.
Where is she right now?
She's mostly at my sister's house. So she lives, we kind of help her, my sister, my brother, and I.
Governor, a conservative group with the help of former state Supreme Court Justice Flanders has kind of put together a legal analysis suggesting that you may have overstepped your authority in some of your restrictions. And I know that's been a criticism on the right, from the right all along. What do you say to those questions over religious gatherings or canceling summer events or making people wear masks and whether you've overstepped your constitutional authority?
So first, let me say, I haven't really wanted to do any of this, you know. As it relates to church, I think I've missed mass 5 times in my life prior to COVID. So the last thing, like missing church, having to wear a mask, shutting down businesses. For 6 years, I've worked 7 days a week to get our economy going again. So I never viewed any of this really as a choice. I'm the governor. I have a duty to protect the people of Rhode Island and make the tough decisions. Now, I understand it's easy to criticize decisions. I do understand that. And I don't pretend everything I've done is perfect. But I do know that Rhode Island is doing very well relative to many, if not most other states. And everything I've done has been in consultation with stakeholders in the community, public health experts, Dr. Nicole's staff. So, and everything we've done has been within legal guidance. You know, every executive order has either been allowed to lapse or renewed within 30 days. You know, the state of emergency gets refreshed within every 30 days. So I understand it's difficult. I understand different people don't agree, but I am making the decisions that I think are in the best interest of Rhode Island.
Thank you, everyone. We'll be back tomorrow.